All right, you're watching this video for post-op instructions after having had a root canal therapy performed. Typically, the nerve is damaged or dies as a result of an injury. The injury can be due to bacterial invasion. It can be due to physical trauma, grinding your teeth, or various other traumas that can occur. The blood supply quits going to the nerve, and eventually you have dead tissue that bacteria invade and then create an infection. The infection oftentimes can go up into the bone and create an abscessed tooth. Depending on how much pain you had ahead of time, you may have quite a bit of pain even after your procedure. So there are times that after a root canal you experience no pain at all, and other times things can be pretty sore for up to a week. Don't expect there to be zero pain afterwards. The tooth can be sore, especially to chew or to bite on for a little while. It's important to take a lot of Aleve or ibuprofen, some type of anti-inflammatory, as most of what we did were just creating some small bruises in there from the procedure. So it's important to stay on some Aleve and to be a little careful chewing on that side. It's important to note with the root canal procedure that if the problem was detected early, we're probably going to have very few complications. Not a very high chance of there being a new infection in that, and probably not a lot of pain after the procedure. If the problem has been detected or the patient has waited too long, then we may have a lot of symptoms ahead of time, and it may take a lot of time for it to calm down. So the success of a root canal is very important on early detection and early treatment. You may notice after your root canal therapy that your face is still going to be numb. The tooth or the area is numb to 4 to 8 hours, so that's not abnormal. I would expect that. Other things to expect are a little bit of tenderness to bite or chew, or to percussion or to tap on the tooth. Reasons to contact us would be if you notice an increase in swelling. After a few days, the pain, you may have some discomfort up to 3 days. After that, it should be starting to diminish. If it's going the other direction and it's getting more painful, especially if there's swelling with that or you're running a fever, then those would be reasons to contact our office. Another reason to contact our office would be some type of allergic reaction. You could have a rash or difficulty breathing, if any, as a result of maybe an antibiotic that was prescribed in conjunction with this treatment, or some type of pain medicine that you took, would be likely causes for that allergic reaction. So if that's happening, please contact our office. When a root canal is performed, it's fairly common for us to prescribe certain antibiotics. One in particular, clindamycin, can create some gastrointestinal distress. If that is the case, it's very rare, but if that is the case, please contact our office. There is another antibiotic that we prescribe to help clear that up and get you feeling better in that case. It is very rare in our office that you would leave with a temporary filling. If that's the case, please be advised you need to have a final restoration performed on that tooth. And please contact and follow up with our office if that hasn't already been done. You may have either a temporary crown on there or a temporary filling, or you may have had the crown done in one visit, in which case you would be finished with your treatment. Many teeth that have had root canals require a full crown or full coverage restoration, because a tooth that's had a root canal is very similar to a dead tree. A dead tree, you bend the branch and it will break easily, and a living tree, you can bend that branch and it won't break. So when the tooth's had a root canal, we essentially kind of have a dead tree. And so if we don't cover, especially the back teeth or the molars, with a crown, then we have a high incidence of that tooth fracturing. And when that happens, many times the tooth is non-restorable and has to be removed.